Hey everyone, welcome to my channel. Today we are going to be talking about something that all of us might have faced or suffered from at some point in our lives, and that is teeth sensitivity. Teeth sensitivity is so common, and so many of you have been asking me to make a video on this. So here we go today. And before I begin the video, let me take a moment to introduce myself to all my new viewers out there. I'm Dr. Upasana Gosalia, founder and head dental surgeon at iSmile Dental Clinic in Mumbai. My channel is dedicated to addressing a lot of common health issues and oral health issues that a lot of us have. So please do subscribe and hit the bell icon to get regular updates and notifications. And do send me your love. Hit the like button if you liked what you see, because that really pushes me and inspires me to make more videos for you guys. So what is this teeth sensitivity actually? Let me just break it down and brief you a little about it. So teeth sensitivity is that sharp shooting pain which occurs in, say, some or all of your teeth when you bite into something which is really cold, like an ice cream, or when you're having a cold drink, something which has a lot of ice in it, or just something which is too cold. This typically gives rise to that sharp sensation in some of your teeth, which we term as teeth sensitivity or dental sensitivity. But mind you, this is not the same as teeth pain. A lot of times I have seen patients getting confused and telling us while they're booking their appointments that I want to see the dentist and I want to come down because I have teeth sensitivity. But actually it ended up to be a toothache or a tooth pain and not the routine sensitivity. So it is very important and vital that we understand the difference between these two before we self-diagnose ourselves or we start treating ourselves for sensitivity. The symptoms that both of these manifest and what they present are completely different. When it comes to teeth sensitivity, the pain typically has a trigger from something which is very cold, like I mentioned. It starts when you have that cold thing, and then the pain lingers for, say, about a couple of minutes, and then slowly subsides and settles on its own. You don't essentially have to resort to any external measures, and the pain is not really intolerable or severe in that terms. When it comes to tooth pain, which I would say is arising from, say, an untreated cavity or the presence of a dental infection which requires some attention and additional treatment, like, say, a root canal or maybe other dental issues, the pain shows up in completely different forms. Firstly, the trigger is different. When it comes to dental infections and pains, most likely the trigger is to having something which is very hot. Like, say, if you're having your hot cup of tea or coffee, the pain suddenly comes in. It's a very sharp pain, similar to what a tooth sensitivity would give you. But then this pain doesn't subside on its own, and it lingers on for longer duration or a longer period of time, and it doesn't just last for a couple of minutes. In fact, there have been patients and there have been instances when they tell us that the pain was so severe that they had to resort to even taking some tablets and painkillers. Also, when you try to lie down or in your sleeping or resting position, the pain starts again and it comes up. So all these are signs of something called as like a tooth pain, which requires some other intervention. There is an underlying definitive cause to it. It is not just your routine sensitivity. So please do not confuse the two, and do not start treating yourself for teeth sensitivity when you have the other, or the other way around. So this was vital to clear this in our heads, the difference between sensitivity and tooth pain. Now, this brings us to the next obvious question, which is, what is tooth sensitivity and why does it happen? So, before I can dive into it and I can explain to you what sensitivity is, we'll just quickly understand what and how a tooth looks like, what it's made of, the different layers and the composition. So, a tooth looks like this. The hardest layer, or the outermost layer of the tooth, which is the enamel, it's, mind you, the hardest substance in the body. Second, below it is dentin, which is slightly softer and porous, and the innermost layer of the tooth, which is called as the dental pulp, which hosts the nerve of the tooth. Enamel, which is the hardest substance in the human body, plays a vital role to protect the inner layer or the dentin of your teeth. This dentin is porous in nature. It's composed of dentinal tubules, which further have something called as nerve endings. And these are nothing but connections to the nerve which is present in the innermost layer or the pulp of the tooth. And these are very sensitive. So when these nerve endings are exposed due to loss of enamel, or when enamel gets worn out and the dentin is exposed, further exposing these nerve endings, this is what causes teeth sensitivity. Now, there are many reasons as to why enamel is lost and teeth sensitivity occurs. But in this video, I'm just going to keep it short and crisp, and we're going to talk about the top few which we have routinely seen in our practice as the causes, most common causes, I would say, for teeth sensitivity. The first and the foremost being exposure of the tooth to acids. Now, what I mean by acids is your diet or whatever you're eating consists of these acids which are exposed, which your enamel is exposed to, and thus slowly and steadily your enamel gets abraded and eroded, as a result of which your sensitivity occurs. There can be a variety of acids leading to this. Firstly, I would say is citric acid in the form of lime, or a lot of patients like to have lemon in a glass of hot water. Sometimes they even like to chew onto a lemon wedge directly. Now, this exposes your tooth to citric acid, and this will slowly erode and take away all the calcium from the enamel, and further, in a longer period of time, it will lead to loss of enamel. Apart from citric acid, there are so many other sources of acid as well that we might be consuming which we're not aware of. Like, say, apple cider vinegar is again acidic and bad for your teeth. There are so many carbonated drinks that we consume in the form of sodas and colas, because this has carbonic acid, again bad for your teeth. And lastly, also patients who have acidity. So if you have acidity, what happens is all the acids, excessive acids present in your stomach are coming up in your mouth because of a gastroesophageal reflux. And these acids, when they stay onto the enamel or they stick onto the enamel of your teeth for longer durations of time, like for example during night time when you're sleeping, this leads to loss of enamel. So in the long run, this can be very harmful for your teeth. So do treat yourself for acidity if you've noticed you have it. Go and speak to your doctor about it and get some long-term solution for it. The second most common cause is bruxism or clenching of teeth. This is a parafunction habit, or simply put, it's something that you're doing very subconsciously. You are constantly grinding your teeth, and this leads to enamel loss, a very generalized form of enamel loss in the long term, and your teeth even end up looking something like this. The third common cause could be presence of recent crowns and bridges. Now, the very fact that you have a crown or a bridge in your mouth means that your dentist has had to grind your teeth, your natural tooth structure, which obviously means that a lot of enamel has been lost. We all want to replace our teeth. If a tooth has been lost, we're certainly going to consider a fixed restoration like, say, a crown or a bridge. But then this comes with a downside, and that is you could get teeth sensitivity immediately post-operative, meaning after placing your crowns and bridges, because a lot of grinding work and a lot of removing of the enamel was involved. And thus, frankly, if I were asked, I would say that I prefer dental implants over bridges any day, because we retain your healthy teeth as they are when it comes to placing an implant. There is no interference or no touching of your adjacent teeth. But if you want to put in a bridge, a lot of grinding of your natural teeth has to be done, and this could have teeth sensitivity as a side effect. So yes, this is again one of the possibilities. A fourth cause could be presence of a very large tooth decay and a large dental filling. We have seen that patients who have very large restorations do get post-operative sensitivity as an immediate side effect. But don't worry, this can be treated and it is absolutely reversible. So we are going to talk about what's to be done for it in the latter part of the video. The next reason could be presence of gum recession. By gum recession, I mean that due to age or a lot of other factors, maybe presence of gum disease or diabetes, your gum levels are going lower and lower, and this is causing your tooth root surfaces to get exposed, And again, these are the areas where nerve endings are present in ample, and thus you get teeth sensitivity. So yes, gum recession is also one common cause for sensitivity, lesser common as compared to other reasons, but in the older generation, in the older population, we've seen that gum recession does cause a lot of tooth troubles, and sensitivity is one of them. And lastly, overusing any teeth whitening products recommended by your dentist or over the counter, irrespective if you're overdoing it or if you're doing it something which is more than what's recommended to you in terms of number of days of use or the dosage, then even this can lead to loss of your valuable enamel. So please do not do that. And now that we've understood why teeth sensitivity happens, what is teeth sensitivity all about, how it's going to manifest and show, now it brings us to the most important part of the video, which is how will you treat it, or what will you do in order to reverse this sensitivity as much as possible and heal it and treat it. So when it comes to the treatment, or what do you do for your teeth sensitivity, first and the most obvious thing to do is find the cause for it. If it is one of these top 6 that I have just listed, say if it is because of exposure of your teeth to any acidic substances, or if it is because you're a clencher and you're grinding your teeth, then the answer is very simple. You just have to make a few alterations and your sensitivity can be reversed. If it's because of acidity, you can go and meet your physician, get yourself a proper course of antacids in the long run and treat it. If you're bruxing and you're grinding your teeth, then meet your dentist and start using what we call as a night guard. You need to wear this as a protective covering or a layer over your teeth. These are custom fit and custom made for every individual. So no, you will not be able to get them over the counter, or even if you do, they are not going to be as precise and they may not be as effective, is what I'm trying to say. So best is to visit your dentist, get a night guard made and start using it diligently. We will not be able to undo the damage that has already occurred due to your grinding habit over these years, but at least we can prevent further damage and we can prevent further loss of enamel. So you must start using a night guard if you're a clencher. And of course, if you know and you've noticed that you're exposing yourself to a lot of acids in terms of citric acid or carbonated drinks, you need to cut down on that, or at least make sure that after you've had your lemon, you immediately rinse your mouth or drink a glass of water and completely wash out all the remnants of that citric acid or carbonic acid which might be left over on your teeth. We do not want them in contact with your enamel for longer periods of time. That's basically the crux of it. Say if you're one of those people for whom the sensitivity is happening either because of the presence of large fillings, recently done crowns and bridges, or maybe gum recessions, etc., then this tip is going to be for you. I strongly recommend the use of medicated toothpaste or gels or ointments, whatever you choose to call them, which are available, some over the counter, some may not be available over the counter, and they are prescription only. But these play a fantastic role when it comes to reversing your sensitivity. If used properly for the stipulated amount of time, in the long run, you are going to see a great change, a massive change in your teeth sensitivity issues. So my top recommendations when it comes to medicated toothpaste for teeth sensitivity would be those in which the active ingredient is either potassium nitrate, stannous fluoride, or strontium chloride. These have worked great with majority of my patients. So when used, I would say at least for 2 to 3 months at a stretch, without taking a break, in the long term, it can really help dealing with your sensitivity issues. What these active ingredients will actually do is it will start forming a protective layer on your exposed dentin and dentinal tubules, and it will help in further remineralization of the enamel in terms of forming a protective coating, which will prevent sensitivity in the future as well. So this is not just like a symptomatic treatment, but a holistic treatment, and it will give you that protection and protective layer and keep you away from sensitivity in the long run. Another toothpaste that I strongly and highly recommend in my practice and to all of you as well would be MI paste or GC toothmousse, depending on which country you belong. It's basically the same product which has two different brand names or trade names. Somewhere they call it MI paste, somewhere they call it as GC tooth mousse. So this GC tooth mousse or MI paste, what this does is it gives ample of calcium and phosphate in your mouth when it comes in contact with the saliva. There's a lot of active calcium and phosphate which it gives to your teeth, and it will promote remineralization of your enamel again. The results are just stunning. For those of you who are having sensitivity because of presence of, say, large bridges or crowns which were recently done, or veneers or something like that, then just applying this gel onto the surfaces of your teeth just twice in a day will do the magic trick for you. But mind you, this paste is derived from a milk protein. So if you are allergic to any milk based products, please do remember to talk to your doctor before you start using it, or just do a small test. Just use a very little amount and test it out before you go all out and you apply it all over your mouth. This is a pro tip that I never forget to give. If you're allergic to any milk products, please use this with caution. So say if you've already tried all these anti-sensitivity products and toothpaste and it hasn't really helped you enough, or even say if your sensitivity has increased to now such an extent that maybe even an exposure to cold blast of air or maybe a simple round of teeth cleaning is hampering and you're not able to take that pain and sensitivity, then I think it's a great idea for you to ask your dentist to give you a fluoride treatment. Again, here the concept is the same, that this fluoride will help to seal or block off all those exposed dentinal tubules, which will further tackle with your sensitivity issues. So that's all about teeth sensitivity, guys. I hope that these tips will help you recover quickly and get better from your sensitivity issues, and also help you to be able to find the root cause of it or why you've been having your sensitivity issues. If there's anything more that you guys want to know about, or if there are some other things that you've tried for sensitivity which have worked for you, then please let me know in the comments below. I love hearing from you guys. And like I say always, stay healthy and keep smiling.